Hi everyone, I'm Sophronia Samouti and I'm a fourth year medical student at Barcelona, London. I wanted to start by sharing a story with you that sort of kick-started my journey into understanding the importance and effect of compassion. So I was in my second year of medicine, and this was in my first 2 weeks in a trauma programme where I had to write a case about a patient that I had seen. I shadowed this case of a 40-year-old lady that had attempted suicide by jumping off a 4-storey building. I had followed her case from her arrival into the various surgeries that she had done. Before presenting my case, though, I wanted to meet this person. I wanted to put a face to this person, to the case that I was writing about. Now, records had shown that this patient was very aggressive. She had various mental health illnesses, such as schizophrenia, bipolar, and severe depression. There were reports of her being very aggressive to my colleagues, and I'd heard her screaming and yelling in the background. So this is what I had expected before going in. On the contrary, when I pulled the curtain, she didn't start yelling, she didn't start arguing with me, but she looked at me, quite helpless, ready to cry, and reached out her hand to me. The patient sat there in pain, holding and rubbing my hand, and then she started crying. She opened up to me, showing a new side of herself. She spoke to me about her family, her childhood, and how excited she was that Christmas was coming up. She showed a side of herself that no other doctor had seen, which exposed the real trauma that this patient was suffering with, the emotional trauma. And then it hit me. How small gestures, such as holding someone's hand without even having to say anything, can have such a profound impact on the patient. And instead of doctors warning each other, saying, this is a very aggressive patient, keep away, they would say, please go and spend more time with this patient. Show her some more love and attention, because this is what she needs. And it is at this point where my relationship with this patient became therapeutic. At the moment when the patient felt that she was listened to, cared for, and valued. So the question is, how can we achieve this therapeutic patient-doctor relationship? In the book, we propose a 3S approach in cultivating this therapeutic relationship with our patients. The first S being symbonesis, weep with those who weep. Etymologically, this word originates from the Greek words syn, together, boneo, meaning to suffer. So literally, suffering together with your patient. Although cultural expressions of symbonesis may differ, symbonesis lies at the heart of most religions, ethical and spiritual traditions, deriving from the golden rule, calling us always to treat others as we wish to be treated ourselves. Of absolute significance in this ceremony of symbonesis is that there must be recognition, acceptance, and respect for the uniqueness of the person in that patient in need. Indeed, this is far more than just being kind. Implicated in this is the ability to supportively communicate a sensitive awareness and affirmation of another person's feelings and the unique meanings that are attached to them. This is central to the building of this therapeutic relationship and a central part of the healing process of the patient. The second part is symbodesis. A pain shared is a pain halved. Deriving from the Greek words syn, together, and bodia, walk, walking with your patient and accompanying them in their journey. The mystery of togetherness is vital to the fulfillment of all human values. No man is an island, writes John Donne. This implies the necessity for societal interlinking. There is indeed a healing power in togetherness on many levels, both practical and psychological. The value of being a patient can confer positive results to both the patient as well as the caregiver. Halving someone's suffering by simply sharing it with them is the great mystery of kenotic love. Kenosis, which is the mystery of self-emptying, of extinguishing all that comes from the self, the ego, and simply abandoning yourself to the will of another. How amazing is that? to whoever that other person may be. In the case of compassionate healthcare, where the art of walking by the side of a patient who is in need, he, the one who decides to undertake this accompaniment, so symbodipsis, must be equipped with absolute kenosis. Moreover, in order to achieve this symbodipsis, one needs to cultivate the act of synchoresis. If you want to go fast, go alone, but if you want to go far, go together. Synchoresis meaning coming from the word syn, together, and choros, space, which refers to being in the same place with the patient, whether that is physically or spiritually, in space or spirit. Today, the majority of us have no time, no space, and no spirit to take on someone else in need. And we need to ask ourselves, is this really because we have no time in our timetable or no space in our timetable? Or is it because there is no space in our hearts? By learning old basic rules like loving your neighbour like yourself and carrying each other's burdens, we can achieve the mystery of kenotic love by losing ourselves in his will and accepting the other person non-judgmentally. Thus, we can indeed be with him in every space that he is, synchoresis. We can selflessly accompany him every step of his journey, symbodipsis. And ultimately, we can suffer with him, symbodipsis, by just totally and selflessly empathizing with him. Thank you so much. I want to say thank you to the International Institute of Compassionate Care as well as the International Medical Ethics Committee for funding our journey here. So thank you, everyone.